With continuous wave Doppler, blood flow is measured all along the Doppler cursor line and cannot be limited to one area. However, the maximum velocity is essentially unlimited. This allows measurement of much higher valvular stenosis or insufficiency velocities. The same steps to optimize the pulsed wave Doppler image are used in continuous wave Doppler. The valve to be measured is centered on the ultrasound screen. Color flow Doppler can be activated to help identify the main flow. Continuous wave Doppler is then selected and the cursor line is placed directly in the main blood flow. When continuous wave Doppler is activated, Doppler gain is used to increase or decrease gain. If wraparound occurs, the baseline can be moved up or down to improve measurements. If wraparound is still present, the PRF or scale can be increased to allow higher velocity measurements. With some ultrasound machines, narrow the beam sector width and turn color flow Doppler off to free computer capacity to allow the continuous wave Doppler. Measure the maximum pulmonary flow velocity. Also, note any insufficiency. When activated, continuous wave Doppler is a one-dimensional function. In this valve graphic, the red laser dot represents the continuous wave Doppler interrogating the valve. Continuous wave Doppler would probably reveal a large valvular lesion with no difficulty. However, the cursor must be directly on a small lesion to reveal a flow disturbance. The black area represents a small localized lesion. You must use the transducer to make tiny movements to interrogate the entire surface of the valve. You angle slightly in one direction and fan slightly, then angle in the reverse direction till the entire valve surface has been covered. This is known as surfing the valve. You could also begin in the center of the valve and make tiny but ever larger circles. Color flow Doppler is very helpful in locating flow disturbances. Color flow Doppler is a two-dimensional function, as represented by this red laser line. With color flow, you must fan or angle across the entire valve to find small lesions. When using spectral Doppler to measure valvular flow velocity, your ultrasound machine automatically calculates an estimated pressure gradient. Pressure gradient is the difference in pressure between the pumping chamber and the receiving chamber. For the pulmonary valve, the right ventricle is the pumping chamber, and the pulmonary artery is the receiving chamber. For example, the pressure gradient in this pulmonary valve is 7.77 millimeters of mercury. If we assume a normal systolic pressure of 20 millimeters of mercury in the pulmonary artery, the right ventricle must generate a pressure of 20 millimeters of mercury plus 7.77 millimeters of mercury to achieve normal pulmonary artery pressure. About 7.77 millimeters of mercury pressure will be lost due to resistance to blood flow through the pulmonary valve. Realize that pressure gradients are usually underestimated. Stenosis means that a valve opening is smaller than normal for the patient's size. This may result from genetic or acquired defects in development or infectious or traumatic incidents. To pump the normal volume of blood through the small valve, the blood must move faster than normal. The smaller the valvular opening, the faster the blood must flow. The pumping chamber must use increased force to get the normal volume through the small opening. So, stenosis results in a pressure overload. Spectral Doppler will tell us the velocity of blood flow and the estimated pressure gradient required to force the blood through a small opening. Stenosis is most important in the aortic and pulmonary valves. A pressure gradient of 10 to 50 millimeters of mercury indicates a mild stenosis. A pressure gradient of 51 to 80 millimeters of mercury indicates a moderate stenosis. A pressure gradient of 81 millimeters of mercury or higher indicates a severe stenosis. This 4-month-old, intact female English bulldog has a moderate pulmonary stenosis. The pressure gradient at the pulmonary valve is 50.6 millimeters of mercury. This means that to maintain a normal systolic pressure of 20 millimeters of mercury in the receiving chamber, or pulmonary artery, the right ventricle, or pumping chamber, must generate a pressure of at least 70.6 millimeters of mercury. This is a significant pressure overload of the right ventricle and has already resulted in a muscular hypertrophy of the right ventricular free wall in this 4-month-old dog. Remember that pressure gradients are usually underestimated. If the pressure in the pulmonary artery is higher than normal, then the pressure of the right ventricle is also higher than estimated here. An insufficiency means that a valve is leaking. This may result from genetic or acquired defects in development or infectious or traumatic incidents. With the mitral and tricuspid valves, chronic increases in ventricular pressure can also stretch or tear chordae tendineae, resulting in a valvular insufficiency. The heart loses efficiency as a pump if a valve is leaking. Clinically significant insufficiencies cause enlargement of the chamber the blood volume is leaking into. Insignificant valvular insufficiencies, such as this one at the pulmonary valve, are common. Systolic leaks of the mitral or tricuspid valves result in a second exit for outflow of blood from the pumping chamber. Forward flow of blood volume to the aorta or pulmonary artery decreases. Some blood volume leaks backwards into inappropriate chambers. Pressure gradients do not indicate the severity of valvular insufficiencies. The severity of valvular insufficiencies is judged by the increase in chamber size and depends on the volume of blood that is leaking. spectral Doppler is not as helpful because small insufficiencies can have very high velocities, but result in the loss of a very small volume of blood flow and have no effect on chamber size. The pressure gradient can still be useful by indicating the pressure difference on both sides of the valve. In this example, a 4-year-old Cavalier King Charles Spaniel has a systolic blood pressure of 160 millimeters of mercury. He also has a mild and early mitral insufficiency, resulting in mild left atrial enlargement. Because of the mitral insufficiency, there are 2 exits for blood flow from the left ventricle. The pressure gradient of the mitral insufficiency is 195 millimeters of mercury. This indicates that the left ventricle is generating a pressure of at least 195 millimeters of mercury and confirms the systemic hypertension. It also means that to maintain an aortic systolic pressure of 160 millimeters of mercury, the left ventricle must generate a pressure of 195 millimeters of mercury. The rest of the pressure is lost through the mitral insufficiency. This 14-year-old Chihuahua mix has mitral insufficiency and ascites. Blood flow through the pulmonary valve is normal at 1 meter per second, or 100 centimeters per second. But there is also a tricuspid insufficiency, causing the right-sided congestive heart failure. The right atrium is larger than the left atrium, indicating a significant tricuspid insufficiency. Pressure gradient at the tricuspid valve is 127 millimeters of mercury, indicating that the right ventricle is generating a pressure of at least 127 millimeters of mercury. In the absence of pulmonary stenosis, pressure in the pulmonary artery will be slightly less than the pressure in the right ventricle. Normal pressure in the right ventricle is 20 millimeters of mercury, and anything above 30 millimeters of mercury indicates a pulmonary hypertension. The pressure gradient of the tricuspid insufficiency has revealed a pulmonary hypertension in this dog. Diastolic insufficiencies of the aortic or pulmonary valves are significant only if they cause an increase in the size of the left or right ventricle. The pressure gradient can still be useful by indicating the pressure difference on both sides of the valve. This dog has a pulmonary stenosis and insufficiency. In the right side short axis view of the pulmonary valve, normal blood flow is negative or down. The upward flow indicates a valvular insufficiency, and the pressure gradient is 36.1 millimeters of mercury. Because of the insufficiency, this pressure gradient indicates a pressure in the pulmonary artery of at least 36.1 millimeters of mercury, or an elevated pulmonary artery pressure. Flow velocity is relatively high at 300 centimeters per second, but the right ventricular chamber does not appear enlarged. To be clinically significant, a valvular insufficiency must result in enlargement of the chamber it is leaking into, indicating a volume overload.